It is Baby Week here on the Fox 25 Morning News, and all week long we'll be going through each individual story of how people become pregnant, the pregnancy process, labor and delivery, and so on. But this morning, there are so many couples who have difficulty conceiving that we thought it'd be a good idea to stop by Boston IVF. This is Dr. Ellen Penzias. Thanks for being here.
Thank you very much.
It's fascinating to me where we are right now, because this is where the magic happens.
This is it. This is where babies happen.
Tell me a little bit about the machines that are behind you.
Sure. What we have here is our operating room, where our scientist will be retrieving the eggs from the patients, putting them into a working incubator, and then a little later this afternoon, what will happen is those eggs and the sperm will be moved into these little incubators right over here, which are state-of-the-art, and this is where fertilization happens and embryos get made.
Now, the reason that this process is done is because, for a whole host of reasons, the natural process might not be hospitable to eventually having a baby. So you guys step in and give it a little boost.
Absolutely right. And the original indication for in vitro fertilization was merely blocked fallopian tubes, so sperm and egg just couldn't physically get together. But as time evolved, we recognized that many forms of infertility could be very successfully treated with in vitro fertilization.
Now, a little earlier this morning, we met a woman who's now pregnant with twins, and that does frequently happen because to ensure that the process continues, there's more than one embryo that's implanted a lot of times.
And our goal is really one healthy baby per pregnancy. Have as many kids as you want, one at a time. So we're involved in a big effort to try to get our patients to put back just one embryo at a time.
Now, when couples come to you, do you find that they're looking to you because they've gone through so many other routes before?
Absolutely, because in vitro fertilization isn't usually the first step. Usually there are many less expensive, less invasive, and much easier, very successful therapies that we have to offer.
Is this something that's covered by insurance? I know a lot of people have questions about that.
Yes, in Massachusetts, a good number of patients do have coverage for infertility, and that's really a very big benefit for our couples.
When it comes to, when people ask you what you do and the process of going through this, do you find that when you open up about your line of work, you hear many more stories than might be expected?
Absolutely. Unlike somebody who has a broken arm, who's walking around with a cast very visible to society, there are thousands and millions of people who are walking around with this silent disease of infertility that you just can't see. But once you mention the topic, everybody starts to talk.
What is the success rate when someone comes here and they're able to go through this process? How sure can a woman be that she's going to become pregnant?
Well, right now, if somebody is under 35 years old, otherwise very healthy, they have about a 50% chance with every time we put back a fresh embryo of becoming pregnant. Of course, as women get older, even if the embryos look healthy, there's probably a little bit higher chance that they're chromosomally abnormal, and that's just one of the natural things we see with reproductive aging.
It's really interesting stuff. It's very exciting stuff to be in here and know about the potential that's just a few feet away from us. We're going to continue all week long as Baby Week continues on the Fox 25 Morning News. This morning we're from Boston IVF. We'll be here for the rest of the morning, showing you the process of how couples who don't have children get a little hope. Back to you guys.